Hi people, I'm in Ruidoso again. It's Monday. I did not graduate from physical therapy. They did the evaluation last Thursday when I was in Ruidoso 3 days in a row, Tuesday, Wednesday, and Thursday. Thursday I had my evaluation and PT session. I have improved significantly. Absolutely improved. And I can tell I've improved, and they were actually measuring it, and I mean, they told me the percentage wise and stuff. I don't remember the details except for, I've definitely improved a great deal. But they said I need some more. So I'm back here, but now instead of twice a week, it's just once a week. Thank goodness. Not that I don't like coming to Ruidoso, but twice a week of driving to Ruidoso is getting to be a lot. So I was here today, and I must say I feel so much better after the physical therapy session now, whereas initially it was pain and torture. It was absolute pain and torture. But over time, I can really tell the difference. I go up and down stairs normally now. I don't even think about it. I just walk down. I'll walk down really big stairs just fine. Without even thinking about it. I swing my leg into my truck. No pain whatsoever. And although I can still tell that I've got some stiffness, and that's why I'm still going to physical therapy, it's not the agonizing stiffness as before. They have a saying in there, pain is not a lifestyle. And I want you to know that that is true. If you are in pain, and you're thinking, well, I'm getting old, I guess I just have to live with it. No, if you've got a bad doctor who you go to for pain, I'm going to tell you that, okay, I'll show you. I just got some firewood too while I was here in Ruidoso. So this is pinon. It's a quarter cord of pinon. And the firewood guy, and the firewood guy's real friendly, conversing and stuff. And then he was asking me questions. So what are you having physical therapy for? and he was asking me these questions about the pain I'm in. And, well, how do you feel after physical therapy? I mean, I was real honest with him, but then I'm a blunt person. I'm honest. I'm just plain honest. I say what I think about all kinds of things. I don't mince words. And so, I told him it's very uncomfortable. It's pain and torture. I did not feel better after a session. I felt exhausted after a session, and like I've got to go take a nap or, whatever. And I said, but over with the weeks, that started to change, and it's not torturous anymore. And I'm so glad. And I was telling him the same thing I've told you all. And then he told me the reason he's asking. It turns out he has terrible pain in his hips. And the poor man, he said, I can't get into my truck. I can't swing my leg up and get into my truck anymore. He says, I have to pivot and turn. He's demonstrating to me the things he has to do in order to get into his truck because of pain and other kinds of pains he has. And he's been doing firewood for decades. And he said all of this hard physical labor, he said, it's taken the toll on me. And at any rate, I was encouraging him, please go to physical therapy. And he talked about how he went to see his doctor. It wasn't Dr. Belcher. It was somebody else. He went to see his doctor about the pain he was in. His doctor told him to take 800 milligrams of ibuprofen a day. By the way, I haven't taken any pain medicine for any of it at any time. I like to avoid medicines and pills and things as much as I can. And he said, so he took the 800 milligrams of ibuprofen that the doctor told him to take daily for this stuff. And he said it gave, or however often he had to take it, he said it gave him ulcers. And so then he's seeing the doctor, and yep, you've got ulcers, And he said, well, I need to have something for this pain that I'm in. The doctor said, I can prescribe you pain medicine, or you just have to live with it. That's what his doctor told him. Think about that. His doctor's a damn fool. So I told him he needs to see Dr. Belcher and over at, what do they call it, Lincoln County Medical Center. And I said, go see her. She's been here just a short time. She came from Houston, sick of Houston as anybody would be, and came out here. And I said, I am ever grateful. I said, I told him. She examined me thoroughly, put me through torturous things on the exam table. I'm screaming, but she got to the bottom of what was wrong and what needed. And she told me, you need physical therapy. She didn't say, here, let's give you some pain medicine. She said, you need physical therapy. And if you don't get physical therapy, blah, 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 blah. So thinking about him, because I just came from him. Just load this up. You know, this is a quarter cord of pinon and a half cord. This truck holds a half cord, but I didn't want to get a half cord because I have to unload it tomorrow. But anyway, thinking anybody else listening, if you're in pain, he told me that he has been in physical therapy before, and this is what he said. He said he was in physical. I asked him, when was that? And he said 15 years ago. 15 years ago, he was in pain from something or another, and he went to physical therapy, and they made him get on a ball and walk around, balanced on this ball, doing all kinds of things and whatnot. And he said, I told him, this is the first time I've been here, and it will be my last. This hurts way too much. And he did not go back. That's what he told me. And I told him, yes, it does hurt. I was in quite a bit of pain and torture after every session for the longest time. But then if you push through it and do it, you're going to eventually get better. And I said, it's like no pain, no gain. Though I know when I was telling the physical therapist this, well, no pain, no gain, I'll do it. He said, well, we don't really want to think no pain, no gain. He started telling me his PT philosophies and stuff. Like I do give a damn about any PT's philosophies. I don't give a hoot about that. What I care about is what works for me. And what works for me is to say no pain, no gain. Because it is pain going through physical therapy at the start. It is. But you've got to make yourself do it. Push through it, because you're going to get so much better. But this Firewood guy, so 15 years ago, he didn't continue with physical therapy. After the first session, he was in so much pain, he thought, F this. And then he starts telling me about turmeric. Now, I know that turmeric has a lot of antioxidants in it. He mentions a bed inverter that, kind of hangs you upside down. That made me think of my Uncle Sherritt, who had all kinds of machines that he would work out on, including something that hung him upside down. At least he demonstrated that to me one time. And all these different things that he was saying that he's been doing. Has it worked? I didn't point it out to him because I just met him. I've never met him before. But I didn't say to him, well, has it worked really? You're telling me you're in agony and getting into your truck, you're having to go through all these contortions to even get in. Obviously, your stuff hasn't worked. PT is what will work. But I didn't say that. I just listened politely. If I continue to get wood from this Firewood guy, and I think I will, eventually maybe I'll try to put a dent in his head. But I'm going to let you all know, you just have to do it to get better. And I am so much better. I am so glad. I have 3 more sessions, but of course I have to do this stuff at home too. And it's not exactly the same. I don't have the machine where you stand on it and it's vibrating through your feet. And it vibrates, deep in your body. You can feel it all over. I sit there and I start kind of swaying to the music he's got going and stuff. And I don't hold on to the bars either. I've seen other people hold on to bars, act like they're going to fall off. I guess I should thank God I have balance. I actually turn away from the bars and look out the window and start driving to the music while this thing is bouncing me all over the place. But that's supposed to be good for your pain. I don't know how it works, but see, I don't have that at home. And I don't have something they were making me get on the last time, and they made me get on it today too. I don't like it. They call it a total gym. I don't like it. But there's equipment that I don't have, and I'm not going to get. But the equipment I can order through Amazon, I have. I'm going to do it at home. So this is for all you old coots or even young coots. Gosh, when I think about it, actually, most of the people I have seen there are younger than I am. Most definitely. Some of them half my age. Others of them look like they're at least 20, 25 years younger. But there are a few who are older. There was a man there today who was older. He was doing the same exercises as I. And then there was a woman who was older. So it's not necessarily for old coots. Physical therapy is for anybody. You all should do it. If you're in pain, go to your doctor. Get a doctor who will prescribe physical therapy for you. Meanwhile, Ruidoso is fine. You know, there's been rain threats today and rain, and there was a emergency alert. And I just have one last thing to say. The little effers who sit there and make videos, up-close videos. I saw it yesterday. Some jackass made an up-close video of a creek flooding here in Ruidoso. And I watched the comments on Facebook, and people who are not here, they think, oh, Ruidoso's gone. Oh, that's just terrible. It's just flooded out. It's destroyed. Blah, 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 blah. People are still doing that. Listen, flash floods is the new normal for Ruidoso. It's going to happen for several years. These people are not going to survive. Their businesses aren't going to survive, so they aren't going to survive here if you all keep that up. Knock it off. So sick of that garbage. Here, this is part of Ruidoso. And, you know, I always say that Ruidoso is rural. Well, yeah, kind of, but it's really town. It's got an Albertsons, so I'm going to go there now. Bye-bye from Ruidoso, New Mexico.